Hey everyone, and welcome back to Life of Medical. Today, we're diving deep into a world that's often unseen but absolutely critical to your health journey, the fascinating realm of diagnostic and imaging devices. From the familiar X-ray to the futuristic applications of AI in radiology, these machines are our windows into the human body, helping us diagnose, treat, and understand what's going on inside. So, if you've ever wondered how these incredible technologies work, why they're so important, or what the future holds, you're in the right place. Let's get started. What exactly are diagnostic and imaging devices? All right, let's start with the basics. What are diagnostic and imaging devices? Simply put, these are sophisticated pieces of medical technology designed to create visual representations of the interior of a body for medical analysis and intervention. Think of them as highly advanced cameras, but instead of just capturing surface images, they can peer through skin and bone to show us organs, tissues, and even cellular activity. Their primary purpose is to help healthcare professionals detect abnormalities, diagnose diseases, monitor the progression of illnesses, and guide treatments. From a tiny, handheld ultrasound transducer to a massive, room-filling MRI machine, the spectrum of these devices is vast. They utilize various forms of energy, like X-rays, sound waves, magnetic fields, or radioactive substances, to generate these crucial images, providing invaluable information that often cannot be obtained through a simple physical examination. Without these tools, modern medicine would be navigating in the dark, making precise diagnosis and effective treatment incredibly challenging. How do these incredible imaging technologies actually work? This is where things get really interesting. How do these imaging technologies actually work? Each type operates on a unique principle. Let's break down a few common ones. X-rays, the oldest form of imaging, pass high-energy electromagnetic radiation through the body. Denser tissues like bone absorb more X-rays and appear white on the film or digital detector, while softer tissues appear darker. CT scans, computed tomography, take this a step further by using a rotating X-ray source and detectors to create cross-sectional slices of the body, which a computer then reconstructs into detailed 3D images. MRI, magnetic resonance imaging, is completely different. It uses powerful magnets, radio waves, and a computer to create incredibly detailed images of organs and soft tissues. It works by temporarily aligning hydrogen atoms in your body and then detecting the signals they emit when they return to their normal state. Then there's ultrasound, which uses high-frequency sound waves. A transducer sends these waves into the body, and they bounce back off different tissues, creating echoes that a computer converts into an image or sonogram. This is famously used in pregnancy, but has a vast range of other diagnostic applications. Each method has its strengths, providing doctors with a versatile toolkit for peering inside the human body without invasive surgery. Why are diagnostic imaging devices so crucial in modern medicine? So, why are diagnostic imaging devices so absolutely crucial in modern medicine? Their importance truly cannot be overstated. Firstly, they are fundamental for accurate diagnosis. Many diseases, like early-stage cancers, fractures, or internal bleeding, would be nearly impossible to detect without the visual evidence provided by these scans. This early and precise diagnosis leads to more effective and timely treatment, significantly improving patient outcomes. Secondly, imaging devices play a vital role in treatment planning. Surgeons, for instance, rely heavily on CT or MRI scans to map out complex operations, understanding the exact location and extent of a tumor or abnormality before they even make an incision. They also guide minimally invasive procedures, allowing doctors to insert catheters or needles with pinpoint accuracy. Furthermore, these devices are essential for monitoring disease progression and treatment efficacy. Regular scans can show whether a tumor is shrinking in response to chemotherapy, if an infection is clearing up, or how a broken bone is healing. This allows for adjustments in treatment strategies, ensuring patients receive the most appropriate care. Essentially, they provide a roadmap for navigating complex medical conditions, enhancing both the precision and safety of healthcare. Who operates these advanced medical imaging machines? When you go for an imaging scan, you'll encounter a team of skilled professionals. So, who operates these advanced medical imaging machines? The primary professionals are radiologic technologists, often called rad techs or medical imaging technologists. These are highly trained individuals who specialize in operating the specific imaging equipment, whether it's an X-ray machine, CT scanner, MRI unit, or ultrasound device. They are responsible for positioning the patient correctly, ensuring their safety and comfort, selecting the appropriate machine settings, and acquiring high-quality images. They work closely with radiologists, who are medical doctors with specialized training in interpreting these medical images. After the technologist captures the images, the radiologist analyzes them in detail, looking for any signs of injury or disease. They then write a comprehensive report that is sent to your referring physician, who will discuss the findings with you. Other professionals might also be involved, such as medical physicists who ensure the equipment is functioning correctly and safely, and nurses who may assist with patient care, particularly if contrast agents or sedation are required. It's a collaborative effort to ensure you get the best possible diagnostic information. Where are these diagnostic and imaging devices typically found? You might be wondering, where are these diagnostic and imaging devices typically found? The most common place to encounter a wide array of this technology is, of course, within hospitals. Large hospitals often have dedicated radiology or medical imaging departments equipped with X-ray machines, CT scanners, MRI units, ultrasound systems, mammography units, and sometimes even more specialized equipment like PET scanners for nuclear medicine. However, they aren't exclusive to large hospital settings. Many outpatient clinics and specialized imaging centers also offer a variety of scanning services. These facilities can provide more convenient access for non-emergency imaging needs. Furthermore, the field is seeing a rise in portable diagnostic devices. Handheld ultrasound machines, for example, are becoming increasingly common, allowing doctors to perform quick assessments at the patient's bedside, in emergency rooms, or even in remote field locations. Smaller, specialized X-ray units can also be found in dental offices or orthopedic clinics. The location often depends on the size and complexity of the device, the level of specialized personnel required to operate it, and the specific needs of the patient population being served. When are different imaging scans typically used? Knowing which scan is right for which situation is key. So, when are different imaging scans typically used? The choice of imaging modality depends heavily on the patient's symptoms, medical history, and the specific information the doctor is seeking. For instance, X-rays are often the first line for suspected bone fractures, certain lung conditions like pneumonia, or detecting foreign objects. If a more detailed view of soft tissues, organs, or complex bone injuries is needed, a CT scan might be ordered. CTs are excellent for identifying tumors, internal bleeding, blood clots, and issues in the abdomen or chest. MRI scans are superior for examining soft tissues with high contrast, making them ideal for brain and spinal cord issues, joint and ligament injuries, and certain types of cancer detection and staging. Because MRIs don't use ionizing radiation, they can be preferred in certain situations, especially for children or when multiple scans are needed. Ultrasound is commonly used during pregnancy to monitor fetal development, but it's also invaluable for examining organs like the gallbladder, kidneys, liver, and heart, echocardiogram, as well as guiding biopsies and assessing blood flow. The win is always determined by a physician based on a careful evaluation to ensure the most appropriate and informative test is selected for the individual patient's needs. Key types deep dive: X-ray, CT, MRI, and ultrasound applications. Let's zoom in a bit more on the applications of the main players. We've touched on how they work, but the specific applications of X-ray, CT, MRI, and ultrasound are vast. Beyond broken bones, X-rays are crucial in mammography for breast cancer screening and in dental offices for detecting cavities. CT scans are workhorses in emergency rooms for quickly assessing trauma patients, identifying strokes, and evaluating acute abdominal pain. Their ability to provide rapid, detailed cross-sectional images is invaluable in urgent situations. MRIs, with their exceptional soft tissue detail, are indispensable in neurology for diagnosing conditions like multiple sclerosis, brain tumors, and spinal cord injuries. Orthopedics relies on MRI for detailed views of torn ligaments, cartilage damage, and subtle bone injuries not visible on X-rays. Ultrasound's real-time imaging capability makes it perfect for guiding procedures like needle biopsies or fluid aspiration. It's also a primary tool for vascular studies to detect blockages or narrowing in blood vessels. Each technology has carved out its niche, though often they are used complementarily to provide a complete diagnostic picture, showcasing their individual strengths in various clinical scenarios. Balancing act: the risks and benefits of medical imaging scans. It's natural to have questions about safety. So let's discuss the balancing act: the risks and benefits of medical imaging scans. The overwhelming benefit, as we've discussed, is their power to diagnose illness and injury accurately and often early, which is critical for effective treatment. However, some imaging methods do come with potential risks, primarily concerning radiation exposure. X-rays and CT scans use ionizing radiation, which, in very high doses, can increase the theoretical risk of cancer later in life. This is why medical professionals always adhere to the ALARA principle, as low as reasonably achievable, using the lowest radiation dose necessary to obtain the required diagnostic information. The risk from a single X-ray or CT scan is generally very small, and the diagnostic benefit almost always outweighs this minimal risk. MRI and ultrasound do not use ionizing radiation, making them inherently safer from that perspective. MRI's main risks involve its powerful magnetic field, so patients with certain metallic implants, like older pacemakers or cochlear implants, may not be able to have an MRI. Contrast agents, sometimes used in CT and MRI scans to enhance image clarity, can rarely cause allergic reactions or affect kidney function in individuals with pre-existing kidney problems. Your doctor and the radiology team will always weigh these factors and discuss any potential risks with you before a scan. The future of diagnostic imaging: AI, portability, and precision medicine. Looking ahead, the future of diagnostic imaging is incredibly exciting, particularly with advancements in AI, portability, and precision medicine. Artificial intelligence, AI, is poised to revolutionize radiology. AI algorithms are being developed to assist radiologists by rapidly analyzing images, detecting subtle abnormalities that might be missed by the human eye, improving workflow efficiency, and even predicting disease risk or treatment response. We're also seeing a trend towards more portable and point-of-care imaging devices. Imagine handheld scanners that can provide instant diagnostic information in an ambulance or a remote clinic. This increases accessibility and speed of diagnosis. Furthermore, imaging is becoming increasingly integrated with precision medicine. Advanced imaging techniques can help characterize tumors at a molecular level, guiding targeted therapies. Innovations in contrast agents and imaging probes are allowing for visualization of biological processes at an even finer scale. We can expect clearer, faster, and more informative images, with less radiation exposure where applicable and a more personalized approach to how and when imaging is used, ultimately leading to even better patient care and outcomes in the years to come. Wow, what a journey through the world of diagnostic and imaging devices. From the fundamental principles of X-rays and MRIs to the incredible potential of AI, it's clear that these technologies are at the very heart of modern healthcare. They empower doctors, inform patients, and ultimately save lives. I hope this gave you a much clearer understanding of what happens behind the scenes during these crucial medical procedures. If you found this video helpful, please give it a thumbs up, subscribe to Life of Medical for more deep dives into the medical world, and hit that notification bell so you don't miss our next exploration. Do you have any experiences with medical imaging or questions we didn't cover? Drop them in the comments below. I'd love to hear from you. Thanks for watching, stay curious, and stay healthy.